Hi, I'm Dr. Jason Dulac coming to you from my office in Springfield, Virginia. Here at the office, we get a lot of questions about dental bridges. Today, I want to answer some of the most common questions about bridges, go over what they are, what they're used for, advantages and disadvantages, help you better understand what a bridge is and if it's a good choice for you. Of course, if you have any questions about a bridge, please give us a call at the office. We'd love to see you for a consult today. Our office number is 703-451-4500. What is a bridge? A bridge, common name for what we call a fixed partial denture. We call it a bridge because much like a bridge has, landmass on either side, a bridge going over, water or whatever. In the mouth, if you're missing a tooth, you have teeth on either side or implants on either side, you can connect 3 crowns in a row or more. The longer the span of the bridge gets, the more the forces are on it and the less long it will last. But typically, it's one missing tooth and tooth on either side, but you can do them over longer spans. The goal of the bridge is to replace a missing tooth. In this day and age, I'd recommend implants over bridges for most patients, but some patients aren't a candidate for dental implants or they don't want to go through the healing time associated with letting the implant integrate into the bone, and they prefer a bridge. And a bridge is still a great prosthesis that we use today for a lot of our patients. What's the difference between a bridge and dentures? So when I say a bridge, I mean a fixed bridge. It's cemented in the mouth like a crown. It doesn't come in or out. A denture or removable partial denture, which is another way to replace multiple missing teeth, is removable, comes in and out. You can take it in and out. What are some of the pros and cons of bridges? So pros, can be done quickly. Cost-wise, you're looking about the same as an implant nowadays. Additional pros, if you're not a candidate for dental surgery, that would be an indication for a bridge. But the main reason patients in my office select bridges is that they're quicker. So a bridge can be done in 2 visits, 1 visit, and then you have a temporary, then 2 weeks at the lab, and then a delivery appointment. So it's a 2-week procedure, whereas implants minimum 2 months to heal, sometimes up to 4. What are the different types of bridges? So bridges are typically made with teeth on either side, and they're typically made by preparing each tooth for a full crown. That's one of the downsides of bridge. You do have to crown the teeth on either side. For younger patients or in some indications, we can do what they call a Maryland bridge or a bonded bridge, where you have these little fins or veneers on the backside of the teeth, and then you hold a tooth in the middle. The advantage of this is you're not having to crown the teeth on either side. However, it's not going to be as strong. So the bond there is not as strong as the full crown. So you compromise some strengths and sometimes some aesthetics, but it is a good option if you don't want to touch the tooth on either side. What are some of the alternatives to a bridge? Implants would be the primary alternative. You could also do something removable like a partial denture, but if you want something fixed that's in the mouth that doesn't come in or out, you're either looking at implants or a bridge. What is a removable bridge and what is a fixed bridge? So when I say bridge, I mean a fixed bridge, a bridge that's cemented in the mouth. I think some people use removable bridge as a word for a removable partial denture, something that comes in and out of the mouth and replaces multiple teeth, but it does not stay in the mouth. When I say bridge, I mean something that's permanently cemented in your mouth. What is a cantilever bridge? So a cantilever, imagine a diving board, pressure on one side, anchor on the other. Not typically indicated in dentistry. However, there are some situations where you might not want to modify an additional tooth. Usually in the anterior moving forward, or sometimes off of implants, you can do 2 implants and 1 crown forward. So it is done on occasion. There are some indications for it. But as you can imagine, if all the forces are over here and the anchors are over here, that can cause stresses on it. So the indications are limited and dependent on patient's bite and other factors. But there are times that we do cantilever bridges, and that's what a cantilever is and what they are. Can a bridge help with gum disease? Not really. Bridges are actually harder to clean. So it actually kind of puts more force on the teeth, usually makes you more prone to gum disease or periodontal disease. However, splinting of the teeth can be done for periodontal benefits. Typically, this is done with a wire bonded to the teeth. However, you could do it with other forms of bonding. I wouldn't think of a bridge as something that would strengthen or reinforce the teeth because you're putting the force of additional teeth on the remaining teeth on the side. So periodontal complications, gum disease complications, weakening of the teeth are some of the main disadvantages of a bridge and some of the reasons I'd recommend an implant. But you could splint the teeth to reinforce them. That's typically done different ways. Is bridge work painful? No. In my office, I will not work on you unless you're totally numb. So a bridge would be very similar to a crown, or if you've not had a crown, a filling appointment, we numb you, we do the work, You leave with a temporary. It is a 2-visit procedure, but you're not going to have problems with the temp. And when the final's in, it's going to be totally good to go. So if you're nervous about dental work, we have laughing gas in the office. We have nitrous oxide. We can do Valium or Xanax or some type of benzodiazepine to take the edge off. There are a lot of tricks we have for anxious patients. So I know a lot of people don't like to get dental work done, but being concerned with pain should never be something on your mind in my office, because I will not work on you if you're not. What is a bridge procedure like? We'd give you some numbing, prepare the teeth on either side, scan them. In my office, we're all digital. We have a scanner, no putty molds. I would then send that scan to the lab. While the lab's making that, it's going to take about 2 weeks. I'm going to make you a temporary that day. So you have a temporary bridge when you leave the office that day. Won't be as nice as the final, but it'll just be in there for a couple weeks. And then when the final comes in, the porcelain or other materials look very natural, and we'll again give you some numbing, take off the temporary, deliver the final, and you're all set. So the first visit's usually an hour, hour and a half, and then 2 weeks later, another half hour to hour visit to deliver the final. How long does a bridge last? Well, like anything else, depends on how well you take care of it. One of the main downsides of a bridge is it's not going to last as long as an implant. So if you're 60 or under and there's no medical contraindications to getting an implant, I would get an implant, because a bridge isn't going to last you your whole life. You're going to look at a replacement of that bridge in your lifetime. And when you replace it, the cost of the bridge will at that point have exceeded the cost of the implant. So the maintenance costs on a bridge are higher. They don't last as long. So because you have 3 or more teeth splinted together, the longer the span gets, the more stress is on that bridge, the more likely it is to break or chip, or for one of the edges to come loose. If anything happens to that bridge, any chip, anything comes loose, decay gets under on either side, you have to replace the entire bridge. So that's one of the main downsides of a bridge, is you're splinting 3 teeth together. If any unit fails, you have to replace all of it. So the maintenance costs on a bridge are higher, and that's the main reason I recommend for my patients they go with dental implant. And in terms of how long does a bridge last, again, depends on how well you take care of it, but average half-life in the United States is about 5 years. I'd like to see you get at least 3 times longer than that with good home care and regular maintenance. What happens to any bridge or any dental work over time is decay gets under it at the edges. So the better you clean it, the more fluoride you get on the teeth, the better you are about your maintenance, the longer it's going to last. How should I care for my bridge? When I deliver a bridge at my office, I give you all the home tool aids that you could need to get under there. They have little picks to go underneath. There are floss threaders where you thread the floss under and go underneath. There's something called super floss, like a thick floss with yarn. Again, you thread it under release and go underneath there. All of those things are very tedious and time consuming. It's not that they're not good, but I tend to find in life if something's easier, people are more likely to do it. So for anyone in my office who gets a bridge, I always recommend a water pick or an air flosser or air water flosser, whatever you want to call it. Little air water pulses to go underneath the bridge and clean it. You do want to clean underneath there, whether that's with tediously getting floss underneath there and going underneath, or with the water. When should I schedule an appointment for a bridge? There's no bad time to schedule an appointment or a consult. If you have any questions about replacing a missing tooth, whether it's a bridge, an implant, a partial, something removable, something temporary, something permanent, please give our office a call at 703-451-4500, and I look forward to seeing you in the office soon.